A neighbor of mine is a mental health counselor and recently mentioned law enforcement agencies are providing crisis intervention training to their officers. Sergeant Jules Brace is here to explain the training and how the team of crisis intervention officers can assist older adults. And Sergeant Brace, thank you so much. What a timely topic this is, because, you know, so many times someone has what we would call a crisis or a situation, or they see a situation. Well, who do they call? They dial 911.
Yes.
And you, as the officers that come out, this CIT training really comes into play now to assess situations.
Yes, it's more timely than ever, as you mentioned. Crisis intervention training is an important and very valuable tool for law enforcement. What it does is it allows the officers to identify that a person that they're in contact with is not trying to be difficult, not trying to break the law, but is indeed having an issue with their orientation, where they're at, their ability to function. They're in a crisis. So when the officers respond, we can interact and engage that person differently if we understand that the underlying problem that's going on is rooted in a crisis that the person's dealing with. So we can absolutely change our gears.
Sure.
And get in more of an assistive state of mind, as opposed to somebody's trying to commit a criminal act.
That's what you were mentioning to me a little earlier off camera, that, you know, it may not necessarily be a criminal situation that you're coming into. You have an older person who may be acting a bit erratically. Here's where that training comes in.
Yeah, they may be in a confused or dazed state. It could be a medical emergency that's the underlying factor. Or a lot of times when people are confused or dazed, and their mind is working against them, they may get aggressive because they're scared. Mm-hmm. So you may hear them getting loud or yelling.
Sure.
That's the part of the confusion. So what CIT does is it trains officers in de-escalation techniques. So you can see and recognize what's going on, mm-hmm. and then start to de-escalate that person so that you can help them, as
Right.
opposed to going in a confrontational mode.
Sure. Now, there are the Florida statutes, and there are probably a couple of terms that folks are somewhat familiar with, but the first one is that statute called the Baker Act.
Yes.
And you'll hear that phrase, oh, someone was Baker acted. So what does that really mean? What does that really involve?
Yes, there is the Florida Mental Health Act, which we call the Baker Act. What it means is if a person has a mental illness, and it doesn't have to be pre-existing, because suicide would fall under that category. And that's something that can be a sudden onset, nothing that's pre-existing. So if a person has a mental illness, mm-hmm. it's determined that they're a threat to themselves or others, i.e. I'm suicidal, I want to harm myself, or if the person is self-neglectful, then we can take that person into protective custody to get them to services. So that's what the Baker Act is. I know recently it's been sort of treated in a negative fashion, but, you know, the Baker Acts are up, the Baker Acts are up. But in reality, that's law enforcement down on the ground level, assisting people, taking them into protective custody, mm-hmm. to save them, to protect themselves, or to protect the individual.
Or potentially someone else.
Yes. So we're actually literally in a caring mode, mm-hmm. where we take them into custody so that they're safe. So I don't see that as a negative thing.
Right.
You know, to me, that's a positive thing.
It's another tool that you have to use to assist with someone.
Yes, and that's what we signed up for. This is a helping profession. Mm-hmm. The genesis of the CIT program started back in 1988 up in Memphis, okay. where there were a lot of negative contacts between law enforcement and people with mental illnesses. So NAMI, the National Alliance of Mental Illness,
right.
The advocates started pressuring law enforcement to come up with training to help officers identify people in crisis. Mm-hmm. So that was the actual genesis of it. And even today, the model that they use, that's used by CIT International, mm-hmm. is what's called the Memphis model. And that's standardized nationwide, and it's even international, where we have interest in countries as far away as Australia and Europe. So what it does is it brings officers in and allows officers to see and speak to experts in particular fields. One of the fields is dementia, Alzheimer's, seniors.
And really just identifying those.
Identify some of the signs
Right.
that can cause a senior to go into crisis. Identify some of the crises that are familiar or common to that group. For instance, there's a block on veterans. And we know we have a lot of veterans in Florida.
Oh, sure.
And we have a lot of retired veterans in Florida. So there's a block there in the CIT training where we bring in experts who deal with veterans to talk about PTSD and other issues that are common among veterans.
I wanted to just briefly touch on, there's one other statute that I was not familiar with. You don't hear this term. It's the Marchman.
Yes, it's the Harless
Act?
Marchman Act.
Okay.
What that statute is the Substance Abuse Act. So much like the Baker Act, if your underlying problem is substance-based, then we would bring that person into protective custody under the Substance Abuse Act. And when I talk to the officers, the analogy I give, if you remember the old Andy Griffin show,
Sure.
they had Otis.
Yes.
And they would bring Otis in and they would put him in the tank and
Yep.
Otis would sleep it off. And
Every
the next
Saturday
day,
night, yep.
he was fine. So when you think of the Marchman Act, you think of Otis. And what it does is it allows law enforcement to bring people into custody, protective custody,
Sure.
if we determine that their issue is substance abuse related, whether it be alcohol. We're in the middle of the opioid crisis.
Sure.
So if it's a substance abuse matter, then we can use what we call the Marchman Act.
Absolutely. So I'm sure that your officers have wonderful stories, wonderful situations where it's really, that training has come into play.
Absolutely. I was just talking to one of our officers recently who happens to be a veteran, and he said it was an older veteran who lived alone that nobody was checking on. So he went by to check on him because neighbors were calling about not seeing him. When the officer made contact, he noticed that the veteran had a wound on his leg that he had sustained in the house.
Oh, goodness.
And that the wound had gotten so bad that gangrene was setting in. So the officer was able to get that gentleman over to the VA and get that gentleman some help. And there was some issue with medications where the gentleman wasn't processing clearly. So he was able to assess that also and pass that information on to the VA. And the officer told me just the other day that family members called him to thank him because he said if he had not gone to the infection sooner, that gentleman's life may have been in danger.
Oh, absolutely. And Sergeant Brace, thank you so much for explaining the National Crisis Intervention Training Program and how local residents can access a CIT officer. This is such a great program. Thanks.
Sure.